In today's video, I'm going to share my best IBS supplement advice to help you make sense of all of the conflicting supplement information out there, so stay tuned. If you're returning, welcome back. And if you're new here, my name's Amanda Malicheski. I'm a certified functional nutrition health coach and a digestive and allergy detective. For weekly videos on how to find your personal diet and supplement plan for IBS and SIBO, please consider subscribing and be sure to click the bell to be notified when I post a new video. Literally every single day, I interact with people in internet land who are confused about their gut health supplements. They're confused about how to choose them, how to use them, whether they're appropriate, whether they're not. And honestly, I'm super annoyed with how a lot of the supplement information is presented out there because it leaves out some really crucial information to help you be the most confident that you can be in using these supplements, which can be helpful for you. So in this video, I wanted to share some of the hard-won gut supplement wisdom that I've acquired after coaching hundreds of IBS and SIBO clients over the last several years. This is a view that can be kind of hard to access while you're in the throes of dealing with your own personal IBS or SIBO problem. So I want to illuminate some important things for you and help you just get to a lot more confidence and success with your supplements. So let's get started. So first things first, very briefly, let's just clarify exactly what a supplement is. So for the purpose of this video, I consider a supplement a capsule, a tablet, a tincture, a powder, a gummy, or this is really important, a food that's being used as a medicine. So for example, if you're drinking a 16-ounce glass of celery juice every morning, I consider that a supplement. Or if you're using slippery elm powder for pain in your gut, that's a supplement also. So the very first piece of gut supplement advice I want to give to you is to ask this question. Does the supplement I'm planning on using have evidence to suggest its use for either my symptoms or my condition? A lot of people on the internet will suggest all manner of supplements and other kinds of things to help your gut health. But one of the ways that you can make sure that you are keeping yourself safe and using things that really are going to be helpful is to rely on things that actually have scientific evidence in the form of studies being done on them to back them up. The very best evidence of all is something called a meta-analysis. This is where data from several studies is compiled into one large study to look at the data all together and look at trends across multiple studies. So if we think of gut supplements that have a lot of evidence, especially those with meta-analyses to support their use, there's really actually only kind of a short list of things. And these include things like probiotics and L-glutamine. Also, the herbs neem, berberine, allicin, and oregano oil have been shown to be just as effective as the antibiotic rifaximin for SIBO treatment. Then there are supplements that have moderate evidence, and by this I mean there's maybe multiple single studies that have been done, but there may not be meta-analysis data to say, yes, this is clearly helpful for gut conditions. And things in this category include things like digestive enzymes, slippery elm, zinc carnosine. So these are supplements where there's been a clinical study or two or three or several done that show that these items are helpful and there's evidence to suggest that they perform better than a placebo. Now there's lots of other gut supplements that are commonly in use that don't really have clear evidence in the body of research out there. And the supplement to support stomach acid called betaine HCl or betaine hydrochloride is one of these. There's really not any studies that's been done on it. However, we have a ton of anecdotal evidence from naturopaths and functional medicine doctors and so on who use this in practice and have found that for some patients, it makes a difference. So in this situation, you can still test supplements like these out, but you want to approach it from the perspective of like, okay, I'm doing this as an N=1 experiment to see how this affects me. It might be helpful, it might not. There's not really evidence to suggest that it will be, but I'm still going to try it anyway. I think it's just helpful to have that perspective in mind. And I'm going to talk about how to evaluate these kinds of outcomes for yourself in the next part of this video. My second piece of gut supplement advice for you is to be clear about the gut symptom or gut symptom mechanism that the supplement you're trying is supposed to address. A lot of people sharing information about gut supplements on the internet will share things in the form of a laundry list. The post will say something like, 5 supplements to heal a leaky gut, or 3 supplements you need to heal your gut. And I'm not really a fan of these lists because they tend to just be kind of random laundry lists that don't really dive into whether or not you really need these specific supplements. When you're deciding which supplements to use, it's really crucial that you choose them based on some kind of question that you're trying to answer for yourself about those symptoms or the underlying mechanism of your symptoms. And what do I mean by that? So for example, let's say that you think that your gut symptoms started after about a food poisoning or maybe from a course of antibiotics that you took. So the presumed mechanism of that problem was a shift in your gut microbiome. So in this situation, adding a supplement like probiotics would be a reasonable experiment to try because the problem that you started with was a change in the gut microbiome, and those probiotics may help restore that positive gut microbiome. Conversely, if you think that the problem going on with your gut is that you have low stomach acid, using something like oregano oil obviously wouldn't make sense because oregano oil doesn't do anything to help address your low stomach acid. In the end, just make sure that the supplement you're trying is likely to address the problem that you're actually trying to help. And if you're not sure about this, find someone knowledgeable to ask. I'm curious to hear if you've ever been confused by your gut health supplements. If so, leave me a comment below this video or just click like below the video. So my third piece of gut supplement advice is the gold of this video, I promise you, and that is to try only one new supplement at a time, to start with less than the full dose, and to slowly increase the dose up towards a therapeutic amount. So once you've settled on a supplement to try, you can save yourself a lot of heartache and trouble and trial and tribulation by following this method. And this involves starting one new supplement at a time, again, starting with less than the full amount and working your way slowly up to the full therapeutic amount. A lot of supplement problems start when people start multiple supplements at one time. So maybe your doctor or your naturopath or your functional medicine doctor has given you a really complex protocol on a sheet of paper and they want you to start like 6 new supplements all together at once. Or you heard about or read about something online that is supposed to address a condition that you have or you think you have, and you're just like ready to dive in and get started. But especially in these situations, it's crucially important that you proceed carefully because otherwise you're not going to get good information from your experiments. The goal here is to learn what you need to do to manage your symptoms so you can live well. The goal isn't just to take a bunch of pills and call it good. If you start multiple supplements at a time and you have a bad reaction, you won't know which supplement is causing the problem, and you'll have to quit the whole protocol. Some of those things may have been valuable for you, but you won't know. Also, if you see amazing results, you also won't know exactly what was responsible. This information about what makes your symptoms better and what makes things worse is the most important information for you to create your personalized plan to move forward with your IBS. And it can also take a little bit of time to really get familiar with the effects and impacts of supplements as you start taking them. A lot of people want to just rush through this and just go straight to the end and, oh, I'm just going to take this whole huge amount. But again, you don't get the information you need about the impact of that supplement on your body if you rush things or go too fast. So start low, go slow, and really explore how that supplement is impacting your body. It takes longer, but the information that you get from this process is better than the flare and failure option, which can totally derail you. My fourth piece of gut supplement advice for you is to be clear about the possible contraindications of supplements before trying something new. Just like medications, supplements can have negative side effects and they can have contraindications or times and places where you shouldn't use them. I very often see people preparing to take supplements for things going on in their digestive systems that really are inappropriate for their particular situation. One of the most common examples is the stomach acid support question. A lot of people hear that low stomach acid can cause all kinds of problems with your digestive system, and this is true. But there are 3 really important situations where stomach acid support should not be used. That's if you have active ulcers or suspect that you might, if you have an H. pylori infection or you suspect that you might, and then we just recently learned from Dr. Pimentel that it looks like stomach acid can actually make SIBO worse. Now, there may be exceptions to this rule, but it's important to understand where you stand on this before you dive into supplementing with something that may not be helpful or even harmful. Here's some other examples. Fiber and prebiotics are often contraindicated for people in certain IBS situations, particularly if you already suffer from bloating or constipation. Certain lactobacillus and bifidobacteria probiotics are contraindicated if you have histamine intolerance. Digestive enzymes and bile acids can be really aggravating if you suffer from heartburn or reflux. And so on and so on. Every single situation needs to be assessed on a case-by-case basis to make sure that you are really inviting in supplements that are appropriate for your situation and aren't likely to cause really clear side effects or negative consequences for you. Ultimately, be sure to understand when not to use supplements before you start trying something new, just to make sure that they're currently appropriate for you. As you can probably tell, teaching people how to use gut supplements properly is something I'm really passionate about, because when you learn how to do this task well, you stand to make much better progress with your IBS symptoms. So if this is something that you're needing some help or support with, I strongly want to encourage you to download my free Roadmap to Gut Recovery guide. Inside that guide, I share the same strategy that I use to help my clients find their personalized plan for calm digestion, including using supplements. You can grab your free copy by heading over to confluencenutrition.com/roadmap, and I will leave a link for that below this video. All right, let me know if this video was helpful for you by clicking like or by leaving me a comment. And if you haven't already, please do subscribe and maybe even send this video on to someone who you think could use it. Hope you're all having a wonderful day, and I will see you next time.